is the culmination of 16 years of planning and dreaming and anticipating. But also, as healthcare has evolved over those 16 years, I think that this building is a culmination of care that we can provide in a different way than we could have even conceived 16 years ago.
One of the main focuses for the campus was to try to get a clinic or a location where all providers can be seen at the same time, meaning that regardless if you're pediatric or an adult care, you come to the same building, the same time, so it consolidates for families and individuals. It makes it easier. Healthcare is complicated enough. It shouldn't be a challenge to find where you're going.
We've looked at other models from Budge Clinic, Salt Lake Clinic, Cottonwood Clinic, and others that we have had to bring this design. So today what you see is the evolution of that great thinking and the experience that we've had.
Building these 2 4 or 5-story towers, we call them the bookends, that face one another. On the north side we have the physicians facing the south side, which is the hospital, the emergency room, labor and delivery, the ORs, the inpatient area, and just make really a first-class facility for Aldaview and for the Sandy Draper area.
It's an amazing designed building. Aesthetically, it's great, but the biggest purpose of this is to put as many physicians in the same place as you can get them. Historically, they've been spread out through all over the campus, north and south, and now it's just a simple one stop for everybody.
This building is the fulfillment of that dream of being able to pull everyone together into one location and to be able to make this the center point of access of care for this campus for outpatient care.
One of the things that was really exciting and unique when we were doing the master planning of this campus was to really say, how do we maximize the aesthetic beauty of this site to better improve the patient's care and experience? One of the things that's really important is the view and the actual natural light that can be maximized into these buildings. Has been a very exciting experience to focus where the patients and the caregivers receive that light into the building as part of improving their feel, their attitude, and overall their experience with their visit and with their care.
We've learned that light is a very incredible resource that we have to help with our moods, to help with our demeanor, to help with our perception of the world around us, because this is a healing environment, and light is a healing source for all of us. We all need sunlight. We all need that natural light that comes and helps us to keep that perspective of life.
Well, we might be setting a standard for the way the healthcare system will be, but the thing that is most important to us is caring for our patients. And if it sets a standard, that will come naturally because patients will receive excellent, extraordinary care when they come here with efficiency, but a personal touch.
A building is evidence of many, many years of experience and institutional knowledge that we've gained now in this kind of conceptual design of bringing together a collaborative space like this.
Well, I don't think very many people complain because their visit to the doctor or to the hospital went too quickly. Quite to the contrary, they frequently complain that it takes time and that it's difficult and inefficient. So certainly designing the facility and the layout and the workflow in a way that makes it more efficient and more convenient for patients. We want them to have, yes, high quality, safe care. At the same time, we would like for them to have a good experience while they're with us too.
When you think of the on-stage, off-stage model, consider it like a theater where you have the actors and the play right before you. But behind the scenes, you have the stagehands and the crew that is working hard to make sure that the experience that you have in the audience is the foremost important thing.
On-stage, off-stage is a kind of a newer idea for a clinic. Basically, each exam room has 2 doors. One is basically the patient door, and the other one is the clinical staff door. And the idea is you flow a patient down a patient corridor where only patients go. You enter in from one side of the exam room. The clinical staff has kept their desks in a separate area, and that's where the clinical staff enters from that care area. The flow is very kind of straight line as much as possible. We bring our lab services, our lab draws to the room instead of having the patient leave and go to somewhere else to get them done. Our follow-up appointments will be done inside the room. So as much as possible, we bring the services to the patients versus sending a patient somewhere else.
We will see you as soon as we can see you, which is immediately So we can get you in. We provide the personal care that patients have been used to in our other location. And that same excellent care is going to happen here in this beautiful building. And I think the building layout and design will help us be more efficient, but it will not take away the personal contact and feeling we have with our patients.
One of the great rewards and challenges of taking on a project like this is it starts as a passion and as a thought, and then it evolves into putting it into writing and coming up with plans and architectural design of how do we bring to life our vision. And then you have incredible teams that create what we're standing in today. And it allows us to take advantage of someone's vision and someone's strategy maybe 10 years ago. And now we are literally standing in people's thoughts. And it's real. And it's not just a concept on a paper or on a whiteboard somewhere. It's bricks, it's mortar that people will come in daily, and not just by ones and twos. There will be hundreds, if not thousands of people that will be impacted daily with what this facility means to our community.
This is an exciting time in healthcare, exciting time for the innovations, the technology, and the coordination of care that we have never seen. It is unprecedented what Intermountain Healthcare is doing now to coordinate the care of a patient.
This certainly has been one of the most exciting projects that we've had a chance to work on in bringing together this entire campus into this building that now we can enjoy.
The thing that I do, which is kind of my trademark, is we end the huddle and we say, woohoo, have a great day. That's my thing that I do. So we are gonna woohoo as we come over here, and it's gonna be great.